My favorite study on kind of health span and longevity in general is the Harvard study on aging. And very long, I think it's 80 years now, big study. They looked at like, what are the factors that make the biggest difference? And not just longevity, but happiness as well and contentment, because what does it matter if you live a long life if you don't have those? And it was very clear. The number one thing was connection, like social relationships. In this study, they found that social isolation is more harmful, takes more years off of your life than smoking or drinking too much. We know smoking decreases your lifespan by 10 years on average. When you have strong relationships, you have better physical health, blood pressure, risk of chronic disease, things like this, emotional resilience, cognitive protection. People with strong social ties had better memory retention and low risk of cognitive decline. All of these things are so important. And I try to remind people that like, there's no molecule, no biohack, nothing that's going to come close to increasing your health span, longevity, and happiness than connection.
Collective Insights is a voyage through topics and technologies revolutionizing human well-being. Groundbreaking approaches for a better world and a better life await you. Welcome to Collective Insights.
Hi, I'm Dr. Gregory Kelly. Before we get into this week's episode, I want to talk about one of the most important molecules in your body to help you age well. I'm talking about NAD+. High NAD+ levels help our bodies stay youthful in so many ways, such as creating energy, maintaining healthy DNA, detecting and using nutrients efficiently, and protecting your cellular health. But in our 30s and 40s, our NAD levels start to plummet. That's why our science team made Qualia NAD+. Qualia NAD+ is a clinically tested formula with an uncommonly advanced approach. It can boost NAD+ levels up to 50% by combining 14 key ingredients, including 3 premium NAD+ precursors, working together to support NAD+ production deep into life. To learn more about NAD+ research and to try Qualia NAD+ risk-free for 100 days, go to qualialife.com/NAD15 and use code NAD15 for 15% off Qualia. That's NAD15 for better aging at qualialife.com/NAD15. Hi, this is Dr. Greg, and today we have with us Dr. Matthew Dawson, the CEO and founder of Wild Health, whose passion is longevity, personalized health optimization, and disease prevention. He's the author of 2 textbooks, has published several dozen studies, and has won national awards for innovation and education. He's also the co-creator of 2 podcasts with over 1 million views each, and has a medical education app that's been downloaded over 1 million times. Welcome to our show today, Matt.
Thank you. I'm excited to be here.
Yeah, I was looking a little bit, in prep for the show at what Wild Health offers, and it's super interesting. So I think our audience is going to really love today's show. So with that, maybe we can start with you giving us a little bit of your story and how you got to eventually launching Wild Health.
Sure. Yeah. So I was in traditional medicine, and after about 6 or 7 years in traditional medicine, I just started feeling like, what we're doing is not working. I would see the same patients over and over coming back with the same problems. And I was in emergency medicine at the time, and it was very gratifying for someone to come in and you'd be able to intubate them or do something that saves their life, but it was the same thing. And I was reminded of this story where there's a little village and someone is floating by in a river one day and yelling for help, and they all run out and they save this person's life. And the next day it happens, they do the same thing again. And on the third day, somebody finally says, maybe we should go upstream and see who's throwing these people in the water. And that's what just kept getting in my mind more and more, is I want to have a bigger impact by getting further upstream and helping prevent some of these disastrous things that we were seeing. And as I was having that thought, my co-founder of Wild Health, Mike Mallon, and I, we started seeing all of this evidence emerge around precision medicine and genomics. And it looked to us like it was finally ready for prime time. We finally could actually base treatments and even nutrition and exercise, not just medications, on someone's DNA and make it very personalized. So we dove in, we sequenced our own DNA, we were looking at other friends and family's DNA. And as we were going through this, Mike had a really difficult issue. He found out his cholesterol was through the roof. It wasn't a little elevated like it was a dangerous level. He saw his doctor. His doctor told him to do a new diet that works for most people, but Mike's not most people. So it actually got worse on it. His doctor wanted to start him on a statin, which is fine. Statins work for most people, but some people get really bad reactions to them. And he was one of that minority. He didn't tolerate it at all. Had really bad muscle breakdown and myopathy. And as he's going through this, we were looking at his DNA, and a couple of things became very clear. These were big aha moments for us. Number one, he needed to be on the opposite diet of what his doctor had put him on. And number two, he had a very specific SNP that made him almost guaranteed to have that bad result. And we were a little upset and angry, like, why did his doctor not know this? And then we remembered medicine's always about 15 years behind. That the science is out there and no one is doing it. So we went all in. Then we were both at universities. We left our universities. We started Wild Health and started seeing patients and treating them with this new precision medicine approach.
Wonderful. There's a couple terms, if you don't mind, I'd love you to just define for our listeners. I think many will know them, but one is SNP and the other is precision medicine.
Yeah, so a SNP is a single nucleotide polymorphism. So it's a difference that we all have in our genetics. And then precision, and I'll give you an example of that. And precision medicine is just taking, in my mind, taking a very data-driven, personalized approach, not taking a one-size-fits-all approach. Like with medicine right now, when we say something works, when we say a study says this works, what we're really saying is the study says this works for 60% of people, maybe 70, maybe 80, like Mike and the statin. But what about the other 20% that it doesn't work for? Can we identify that earlier? That is precision medicine. So to give you an example of that, one of the first people that we saw was my grandmother, who came to us. She had dementia at the time, kind of moderate dementia. She had a MoCA score of 16, which is kind of moderate. With dementia, you want a slow progression. You want to go 16, 15, 14, not 16, 10, 5, not falling off the cliff. So we sequenced her DNA. We did a bunch of blood work, looked at microbiome, looked at all of this data, these kind of millions of data points. And we came up with a very, very precise plan for her for the right diet, exercise, her entire lifestyle, what supplements will or won't work. And 3 months later, when I saw her back, she went from a MoCA score of 16 to 20, like a 25% improvement, which just doesn't happen. Now, I told you I'd give you an example of a SNP. So the next person that I saw was my mother. I was worried that she would inherit a gene from my grandmother that made her more likely to get dementia. And so when we sequenced her DNA, we found she had an ApoE4 gene. So everyone has this ApoE gene that most people have heard about at this point. You get 2 copies, one from your mother and one from your father. She had a 3 and then she had a 4. It's a specific variant. So this SNP, she had this ApoE4 gene, and that made her 200 to 300% more likely to get dementia, like my grandmother did. So in noticing that, what I told her is, said, Mom, this is great news. We know about this and we know what to do about it, and we're going to prevent this. And she also had insulin resistance, was obese, and we put her through the program. And in 3 months, she lost 40 pounds, reversed her insulin resistance, and she said that she felt 20 years younger. And that was another proof point. That's how we use something like this SNP. And then even in her treatment, when we designed, like, what's the perfect diet for her? She had a FADS2 polymorphism, meaning she needed more omega-3, a VDR SNP, meaning more vitamin D, collagen 5A1, meaning she needed more collagen, BCMO, meaning she needed more vitamin A. So we were able to bring all those together and say, Mom, the perfect food for you are sardines. You get a ton of little vitamin A, vitamin D in the organs, the omega-3, the collagen protein. And we're able to take genetic SNPs and find, like, what is the perfect food for someone versus what is a kryptonite food. Like, she had an SH2B3 polymorphism, meaning wheat and gluten are going to be inflammatory for her. So that's how we use these SNPs to then be able to guide treatment for people.
Wow, that's fantastic. One of the things I've seen, and I'm just curious to get your thoughts on it while we're talking about SNPs, is there tends to be almost a misunderstanding. So I like that you used with the ApoE risk increase, right? Mm-hmm. Many things, there's clearly some things with genetics that, a certain gene may be destiny, but mostly it's like a matter of risk or changing flux through a pathway. And so what I see fairly frequently with the MTFR polymorphism, people will then be like, oh, like these other types of folate will kill me. Like, I can't use these. And that's not really true, right? What's true is the flux through that is just reduced for them. So I think precision, both in terms of understanding and interventions, will eventually grow.
Yeah, that's a great point. Thanks for making that, because there are some deterministic genes like the Huntington's disease, like the HTT gene, that is kind of causative. But the ones that we're talking about are just risk genes. And it's so much more complicated than people make it so often. Like the MTHFR, I love that example. There are multiple MTHFR genes. So like when we're seeing someone and talking about methylation, we'll look at all of their MTHFR genes, score that, and then we're not done. Then we look at their blood work. What is their homocysteine? How are they methylating? And then when we talk about what to do about it, it can be a combination of food. Like I had someone yesterday that had high homocysteine, a lot of MTHFR mutation, but we didn't start with a supplement, B vitamins yet. We started with food that's going to increase that, and we'll see if we can solve that problem with food. And then if we need to, we'll go to supplements as well. But it's a complex picture. You need to take the whole person into account when you look at these genes. It's a small piece of the puzzle.
Yeah, and I might be misstating this because I just pulled it off your website, but it looked like for a new client that you or one of your team is working with, you would start by doing genomic testing, but then you're going to marry that with functional testing like the homocysteine that you just mentioned, and you use that combination to do the precision recommendations for that person. And I love that you're doing both, because like I have one of the MTFR polymorphisms, but I've never had high homocysteine. So it's, functionally, it's not, my methylation has worked fine is what it boils down to. And so, I think it's always important to do sanity checks, which I'm super pleased to see that you and your team are doing.
Yeah, your DNA is not your destiny. When I talk to people about this, I say, we see what your DNA, because that's your operating system. Like we have to have that. It's a big part. But your genetics only account for about 20% of your health outcome. The other 80% are epigenetics and what you do, your lifestyle, what you eat, how you sleep, what you're exposed to. And so we want to measure that, the phenotype as well, not just the potential. So we have to have all of it. And it's even more than that. Like with my mother, I mentioned the VDR SNP, and she probably needs more vitamin D. Well, we want to test her vitamin D, see what is that level. And we want to know, is she in Florida in the summer or Alaska in the winter? That's going to affect whether we try to solve this problem with food or supplements or what it is. You get it. It's the whole picture that matters.
Yeah. So I don't know if this oversimplifies it, but I think of, understanding your genomics is really important for making better predictions. But at the end of the day, you want to test to see if those predictions are what's playing out in the real world, because things are complicated. So
that's exactly right. And I like the term. I always remind people that it's precision medicine. It's not perfect medicine. Yeah. It's like we get all this data and we make predictions, but then we want objective data of, are we getting the result that we want and that we're trying to get as well.
Great. Well, one of the other tools that I saw that you used was the epigenetic clocks, the biological clocks. Looked like to me they were integrated somewhere. So I was curious when they would fit in with working with a client, maybe explain a little bit about them to our listeners today.
For sure. Yeah. And this is something I've changed my mind on over time. I think 3 years ago, I wasn't that interested in the biologic age clocks and epigenetic clocks, because at the time, what would happen is someone would say they're chronologically 40, and then I get a test back saying they're biologically 36 or 44. Well, I'm still just going to try to optimize them. Like what I really do with that, the kind of so what wasn't there for me so much. Where I've changed my mind is with the newest kind of third generation clocks. So for example, the one I like the best is the PACE. So it's developed by Duke, the Dunedin PACE. And what I love about it is it gives you a rate of aging. It gives you a rate of aging from 0.6 to 1.4. So 1.0 means you're aging normally. If it's lower, you're aging slower. If it's faster, you're aging faster. And the reason this is important and useful to me as a clinician is because it's been shown to be sensitive to change. So if you get pregnant, your rate of aging goes up 20%, and then it comes back down after you deliver and that physiologic stress is done. Same thing if you get COVID, get in a car accident, have hip surgery, your rate of aging goes up, then it comes back down when you recover. So that allows me to do N-of-1 trials with patients. So Stanford just published a twin study where they're looking at omnivore versus vegan diets, and they use this PACE of aging test. And in 8 weeks, changing someone's diet, you could see a change in their rate of aging. And aging is the number one risk factor for all disease. And so having a global marker like this of like, what is your rate of aging right now? It allows me to step back and say, how's everything kind of working together? And then as we take this holistic approach, we're still going to measure their A1C and CRP and triglycerides and all those things. But that rate of aging gives me a really nice dial to see how are we doing overall. And allows us to do things like if someone comes to me and says, I want to go to Panama and do IV stem cells. Well, if they're going to spend $40,000 or $50,000, how are we going to measure if it's effective? And so something big like that may help us do that. Or if someone wants to try a new senolytic product or wants to try rapamycin or something like that, some of these things that we may not have great markers for, rate of aging can be a good proxy for the global effect on the system.
And is there a periodicity that you, or maybe a range of periodicity that you routinely would run those on someone?
Yeah, so there's some data on this. So with the pace of aging, we see that when you do make changes, and it depends on the effect size of the change, you usually see it in a few months. With the Stanford study, for example, that was just 8 weeks, and they saw a significant change. Now, me personally, I'm always doing new things, so I'm testing myself like once a month usually, but that's overkill. I think about every 6 months is kind of a good baseline for folks. And if we're going to do something big, like a big IV stem cell protocol or some new thing that we like rapamycin or something like that, we may do it in a 3-month period there to get a little tighter feedback window.
Okay. And I know True Diagnostics is a lab that does that third generation clock. I think Clock Foundation may also, but True Diagnostics is one that we've worked with in the past. I don't know if you have any particular labs that you prefer.
Yeah, the Clock Foundation, they have the Grim Age 2, which is a clock. True Diagnostic has the 3 clocks that I like the best, which is the Dunedin Pace from Duke, Harvard's Omic MH, and then Yale's Symphony Age. All 3 of these are slightly different, and that Omic MH has been shown to be the best predictor of your time to death. The Symphony Age is the one that's been shown to be most sensitive to change interventions. Like if you do caloric restriction or something, it changes the most. And then the Pace is the one that I like the most because it has really tight intra-class correlations, is very precise, and you see that rate of aging. So those are the 3 clocks that I prefer. They're all from True Diagnostic.
I was just at a conference called RadFest last weekend and got to see Ryan from True Diagnostics speak, and sat down with him at breakfast one of the mornings and got like a download of all the cool additional things that they're working on. So True Diagnostics would be where I would generally go as well.
Well, and I need to disclose something to you, Greg, so this is important. I'm CEO and founder of Wild Health, but about a year ago, when I started seeing how powerful these tests were, we started using them clinically about 2 years ago when the PACE came out. But I started working very closely with True Diagnostic, and just a couple months ago, I took over as CEO of True Diagnostic as well. So I need to make that disclosure to you real quick because you're asking me. I do think those are the 3 best clocks, but I clearly have a bias there, so I should call that out for you.
I think both what True Diagnostics does and Clock Foundation have places, but I think of Clock Foundation as more for the research where health practitioners and consumers, True Diagnostics is maybe much more focused on those markets, and what they're doing is the leading edge of epigenetic clocks. So for listeners, also, I actually picked up a True Diagnostics pace of aging kit to do myself last Saturday when I was with Ryan. So
I wish I was there. I couldn't make that conference, but I wish I was there. Could have met you in person.
Yeah, it was worth the trip up. It was close by. It was just up in Orange County, so just a short drive up from San Diego area. So earlier, you just quickly ran through some other markers like HbA1c. You mentioned homocysteine. Would there be a common panel of more routine lab biomarkers that you have a lot of confidence in and use routinely with your clients?
Yeah, we do a big panel. So how we do it is we do the genetics. Initially, when we see someone, we do a really big panel that's going to give us as much information as possible. After that, once we've identified their risk factors and what their goals are, we may narrow down into more defined pathways to kind of follow along our progression. But we're really just thinking about all the things that are most likely to kill us as Americans. So we think about cardiovascular disease. We're going to look at the genetic predisposition and risks. We're also going to look at the things that matter, like your triglycerides, like your ApoB, your CRP, inflammatory markers, your metabolic health, like with your A1C, insulin sensitivity markers, things like that. Those markers also are the things that's going to increase our risk for cancers and for dementia and for these other things as well. So it's a standard panel plus a lot of other specific things really digging into your more advanced lipid panel, your more advanced inflammatory markers, and then some imaging as well. Depending on the patient, if we're thinking about cardiovascular disease, if they're on a borderline of starting medications or not, or the risk is higher, then we're going to do a Clearly scan, which is an AI-guided CTA of the heart. If we're worried about high risk of cancer or things, we're going to use a GRAIL test, liquid biopsy for 50 cancers, or we may do a whole body MRI. Like those are more specialized if we think the risks are higher, but we try to start pretty broad with someone and then narrow it down from there.
Well, great. So we've talked a bit about the gathering information part, which you're certainly on the leading edge of. I want to shift gears now and talk a little bit more about the to-do types of things, and start with something that I know is a passion of yours, and it's essentially the neurobehavior pillar of health. So which factors influence our neurobehavior, and exactly what is neurobehavior, and what are some of the ways that our listeners might improve theirs?
Yeah. So I think it's an interesting term, even neurobehavior, because when I hear it, I almost just kind of think of everything. Everything we do is influenced by not just the mind, not just the body, but kind of the mind-body connection in the whole person. So when we're trying to optimize someone, whether they're trying to optimize their neurobehavior or just them as a person, which I'm not sure if there's much of a difference in those two, we're thinking of the really big pillars that everyone thinks of, but we really lean into them. Things like nutrition, whether your brain function is so dependent on your omega-3 fatty acids and antioxidants and your vitamins that are critical for neurotransmission and clarity. The gut-brain axis, where we're making sure someone's eating plenty of whole foods and getting plenty of prebiotics and probiotics. Sleep. I don't think there's anything more important than sleep for our neurobehavior and just optimization in general. It affects everything. So we really spend a lot of time talking about how to optimize sleep and exercise. And all of these things, when we look at them, we're looking from how are we going to take a personalized approach to this? So to think about the food. So I gave a couple examples of my mother, kind of a superfood for her. And like that sardine, like the omega-3s in it, the vitamin A, the vitamin D is going to have a really big impact on her mental health, but also what not to eat. So the kryptonite foods for her, like I mentioned, she had an SH2B3, so wheat and gluten is going to be kind of toxic to her when it comes to neurobehavior, just the inflammatory effects. She had an MCM6, which meant that dairy is going to be inflammatory for her. So identifying the superfood, kryptonite foods. And then when it comes to sleep, I'll give you an example because I think patient examples are always important. This is a great neurobehavior one. At an NBA player, this is a max contract guy who came to us for his issue was mood. He's really having a struggle with his mood throughout the year. And when we dug into what it was, like obviously we're not going to start him on SSRI or something like that initially. Like let's figure out what the root cause is. And I found out that it was all his lifestyle. So he was doing the same thing that the other players would do is before a game, he'd have a ton of Red Bulls, caffeine, all these things, because we know that caffeine is an ergogenic aid, makes you perform better, except when actually you dial in to when you separate fast metabolizers versus slow metabolizers, genetically, we found that slow metabolizers actually hurts their performance. And it turns out he's a slow metabolizer. It just happens that 80% of people are fast. So everyone's thought that caffeine works. It only works for 80% to increase performance. We also found genetically that he had an ADORA 2A SNP that made caffeine more disruptive to his sleep. So after the game, he couldn't get to sleep because he was a slow metabolizer. He had all that in there, couldn't sleep. Then he would get to sleep super late, get up just in time for shoot around, repeat these cycles, and it was destroying his mental health. And so once we aligned his genetics and lifestyle together and got him fixing his sleep, the supplements, the caffeine, the things like that, he had a career year and he felt great and he was happier at home as well. And that just something that simple, like the supplements and food you eat and how you sleep plays such a big role in your neurobehavior and how you perform.
This is just my experience, there's a subset of people that have a good interoception would be the brain term, but right, like, our body gives our brain feedback about all kinds of things, but many of us, that feedback loop doesn't work particularly well. We don't have that skill built in, where for me, caffeine, I figured out at a pretty young age. So listeners, some probably have heard me mention that I was an officer in the Navy in the mid to late 80s. And back then, the Navy ran on coffee. Really, there was no Red Bulls or things like that. And I think I made it through those 5.5 years, much of that time doing, midnight to 6 a.m. watches and you name it, with maybe having the total of one pot of coffee. I didn't need it. I always realized that if I had coffee, it would potentially double whammy on my sleep. It would cause me to be much more challenged in falling asleep. And then I would wake up much earlier than normal. So it hit me on both ends. And then the next day I would feel like I needed something to get me through the day. And eventually after the Navy, I started to become a little bit of a coffee snob maybe and do have it now. But there's a window where I know if I have coffee, it's neutral for my sleep helps my performance during the day. But many people are just disconnected from doing the N-of-1 experiments that you do yourself and with clients to see how something really is working. And I think often just naive to how powerful some of the foods and beverages that we drink are in terms of how they interact with our unique genetics.
Yeah. And I love that you said that, like the kind of good versus bad interoception. Another way I would say it for myself, at least, is I'm just very hard-headed and push through things and don't listen to my body when it is sending me the signals. And what I find is it's very helpful to have kind of objective feedback as well. So one of the things with our patients is we have them use wearables quite a bit just so that we can objectively see how something like caffeine or alcohol is affecting their sleep. Because you get some of these people like myself, hard chargers will just push through it until they break. And so sometimes having more than just your sense of it and the interoception, having an extraception, not the interoception, I guess, is very helpful. We developed an app, Wild Health, where it has all of that data, but then we built it on a large language model where it could send you data and you could interact with and ask it questions. And the other day, it sent me an alert saying, hey, it looks like you're overtraining and you're about to get sick or injured. And I looked, and like, sure enough, my HRV had been really plummeting. And it's because I'd been traveling, hadn't been sleeping, had still been exercising just as much. And I realized historically I would have continued to do that until I broke. But having that feedback loop, I then asked the app, I was like, well, design a workout program for me next week to recover, because I said, actually, my right rotator cuff's acting up, my low back's hurting. You're right, I am overtraining. But having that external feedback, I was able to kind of correct a little bit.
When I think that feedback to me is the key thing. We don't improve other than maybe just randomly in any endeavor without a good feedback loop. And what people like you and your team do, you act as that feedback loop and the coach to help people implement it. And there's a reason that high-performing athletes always have a coach, right? We need someone to create feedback loops because often we're blind or just don't have, like, I think like my classic feedback loop story was after the Navy, I decided to learn Thai language. And I can remember during one of the early lessons was on colors. And the Thai word for blue begins with the NG sound. Like, so, at the end of a thing like ring or wing. But Westerners, or we don't have that sound at the beginning of syllables. So we really can't say it, and we can't hear how incorrectly we say it. And I just remember the instructor just repeating the word over and over in Thai, me trying, and him just shaking his head. And I'm like, I can't get there from here. I can't hear how I'm mispronouncing this. I know I am, but I can't hear it. And I think that we all have those things. And just like that sound for me at the beginning, I still, I took Thai for 2.5 years. I still can't say that correctly. Like, my brain didn't develop that feedback loop when I was an infant to hear that sound at the beginning of a syllable. So, that's like a silly story. But for health, we need someone like you and your team and the objective data and then intervention to see, all right, now what moved to create that feedback in multiple feedback loops, because health is complicated.
I love that example. And I mean, to go back to the NBA player, it was the exact same thing. What we were able to notice is on the non-game days where he's not crushing all the Red Bulls and having the caffeine, like, look at your deep sleep, look at your REM sleep, look at how much better your HRV and recovery is the next morning when you get good sleep and you haven't consumed these things. And then we could apply that objective feedback to the game days as well.
Well, shifting gear again, so this obviously these core foundational pillars and you talked about sleep, and I still think sleep crazy important and underappreciated, not in our niche, but in many. Are there any other pillars that you really feel like, wow, we're missing the boat on this, or many people are missing the boat?
Yeah. So everyone knows about sleep, exercise, nutrition, stress, these things. We know about it. We know not to smoke, and we know not to drink excessively, all these things. I think the one thing that gets overlooked, especially, and when I'm talking to people a lot of times, they're thinking about the biohacking stuff and like the really advanced stuff. And I always really try to bring people back to the one thing that I think is most important, which we haven't even mentioned yet. We have a lot of evidence for this. My favorite study on kind of health span and longevity in general is the Harvard study on aging. And very long, I think it's 80 years now, big study. They looked at like, what are the factors that make the biggest difference? And not just longevity, but happiness as well, and contentment, because what does it matter if you live a long life if you don't have those? And it was very clear the number one thing was connection, like social relationships. In this study, they found that social isolation is more harmful, takes more years off of your life than smoking or drinking too much. We know smoking decreases your lifespan by 10 years on average. When you have strong relationships, you have better physical health, blood pressure, risk of chronic disease, things like this, emotional resilience, cognitive protection. People with strong social ties had better memory retention and low risk of cognitive decline. All of these things are so important. And I try to remind people that there's no molecule, no biohack, nothing that's going to come close to increasing your health span, longevity, and happiness than connection. And I like to define that very specifically too. It's not just about connection to others, but it's about connection to yourself, connection to nature, connection to your body, to your food that you eat, and to maybe something bigger than you as well. We don't think about that, but it dwarfs the other things when it comes to your happiness and longevity.
Wayne, I don't know if this is factual or just a story I heard when I was in the Navy, but in the Navy, I remember thinking wow, some of these people that have been in for close to 20 years are aging in dog years. They just looked old for, say late 30s or 40. And back then you could retire after 20 years or potentially stay in for 30. But even if someone went in right after high school, they'd still be a young to middle-aged person when they get out and then have their pension. And someone at a seminar I was sent to in the Navy presented that the reason they did that was because post-World War II, when the Department of Defense had studied it, they found retirees from the military didn't live particularly long, no matter what age they got out. Many of them, say in the 40s and 50s when that study was done, just didn't find a new purpose or, these other qualities that you mentioned. And it seems like the plug gets pulled prematurely when that's the case. And, just a personal story, my dad passed away when he was, I think, 68. And retired. He was a CEO, big engineering company, retired around age 63 and never really found something to challenge his brain and to get excited about. And it just seemed like that without that piece, his health deteriorated quickly. And his health was physiologically, he was a heavy guy, had sleep apnea, a lot of risk factors, right? But, my intuition is that had he not retired then, or had he found a new purpose, that he'd have at least had a few more years, if not many more.
Yeah, I love that. There's a very specific concept that the Japanese have talking exactly about what you're talking about, which is called ikigai. And it's just about having a purpose for their life. And in Okinawa, everyone knows that's one of the blue zones. And when they've studied that, it seems like the thing is they don't really even have this concept of retirement. They don't do that. They always have a purpose throughout their life, and they're living long, and they've studied this. There was a 2009 study, I can't remember what journal it was in, from Japan, looking at this ikigai. And when people have this purpose, they have lower rates of cardiovascular disease, higher life expectancy. They've studied this, and it's a well-known phenomenon. And I think I've never thought about it in terms of the military, but it makes perfect sense when you have had such a purpose and then all of a sudden it's taken away from you. And I think the connection piece that I was talking about solves for that a lot of times. I think when you look at these Japanese cultures, the elders are revered and they have a purpose and with their connection to the younger generations too. So that's a great point. Having that purpose really improves your health and health span.
Yeah, and I think often purpose is what connects us, maybe not all of the connection thing, but it does connect us to something bigger. And, I think, I don't know if it was Eleanor Roosevelt, what was that quote? Something like, many of us live lives of quiet desperation, right? Even many of us are divorced from a great purpose long before retirement. I think that matters from a neurobehavior or mind-body perspective.
Yeah, it's critical. 100% agree.
Great. Well, the next thing I wanted to just, get your thoughts on, since both in what you do as a practice and now in your position with True Diagnostics, my suspicion is you're on the leading edge of what's going on in the longevity space. So are there any, maybe two things that have really caught your attention as, oh, these are things I'm going to do with my current clients, or these are things I'm super interested in tracking to maybe do in the future?
Yeah. One comes to mind immediately because I've been working on it so intensely for the last week. About a year ago at True Diagnostics, we started a study with Harvard, a really big and ambitious study. They have a 100,000 patient biobank. And we had a hypothesis around epigenetics and DNA methylation. When we measure biologic age and pace of aging, The way we do this is by looking at about 1 million genes and how each of those genes, how much each one is turned up and turned down. So the epigenetics, how you're, not just what the genes are, but how you're expressing the genes. That's how we get a biologic age. Well, you get so much information with that. What you can actually tell from that is much more than a biologic age. So there's studies, for example, showing that if I ask you how much you smoked and you tell me, well, if I get a few drops of your blood and run this epigenetics, it'll be more accurate at telling how much you smoked than what you told me. We can tell what zip codes people have lived in based on the gene expression from pollution. So when you take that concept, the next thought is, well, what about diseases? You take something like neurosyphilis, which is a hard diagnosis to make, and to finally make it, you got to go get a lumbar puncture, spinal tap, painful complications, things like that. Or you could take a few hundred patients with neurosyphilis. Cornell is trying to do this study, and then a few hundred controls, find which genes are turned up, which are turned down, find the algorithm, and now you have the fingerprint for this is neurosyphilis with a few drops of blood instead of lumbar puncture. So Grail, Guardant, Exact Sciences, this is what they do for their cancer, is they're looking at DNA methylation. So we said, well, can we take the 7 biggest chronic diseases, cardiovascular disease, COPD, depression, these, and from this biobank, get a couple thousand patients of each, find the fingerprint of this. So that then instead of a cath or something for cardiovascular disease, can we make the diagnosis with a few drops of blood? Now, I can't talk about the results exactly yet because we haven't published yet. We're getting ready to. But I was absolutely blown away, like at potentially how good this is, even for something like depression, there's no blood test, but there could be for some of the psychological disorders. I know one person that's doing a study even of psychopathy in prisons, and can we find the fingerprint epigenetically for that? So, and the other thing that we found in this study, which we'll put a pre-pub out of this probably in the next 30 days, so it may be out by the time this comes out, is you can also predict certain biomarkers. So if we're going to get a CRP for inflammation, we can predict CRP with epigenetics. And Marioni is the first one that did the study. And he showed that CRP, how it correlates to cognitive impairment. The CRPM, the predicted one, actually correlates better, has better hazard ratios for disease. And so we've found, it looks like potentially about 1,600 imputed biomarkers. So and actually the CRP makes sense. So let me stay on that. You and I as a clinician, we don't really care about a spot glucose because it's all over the place. We don't know someone's A1C, kind of their average over time. That's better. That's a better predictor of diabetes. Well, CRP is all over the place. But if you get the biologic effect of CRP over a few months, that's more predictive of disease. So it looks like these biomarker predictions with epigenetics may be better predictors than their LabCorp based value that you get. And we found a large number of these. And so when we publish this, it looks like with a few drops of blood, these epigenetics, we can predict an incredible amount of diseases pretty accurately by finding those patterns and an incredible amount of biomarkers. So it's almost like we're getting to this test that just gives so much more information than anything else by being able to look at these 1 million genes and exactly how they're expressed. So that's what I'm most excited about. I think DNA methylation epigenetics is going to take over a massive amount of just diagnostic testing in general based on how it looks like it's performing so far.
Wow. Very exciting. Anything else that you'd like to share with our listeners about Wild Health and how they can best pay attention to what you and your team are working on?
Yeah, so just at wildhealth.com, we have a podcast. If someone wanted to be a patient, they can sign up at wildhealth.com. The thing that I'm most excited about with Wild Health is there is an app that we created. I mentioned it earlier just briefly, where we took all of this IP around getting these millions of data points and then giving precision medicine recommendations. We took and we built that on top of a large language model to where someone can have an app and they've got health coach right there that knows all of their genetics, blood work, all the wearable data, and they can get the alerts like I talked about when I was over training. They can also interact with it. I was giving a talk in Nantucket a few weeks ago and I was hungry, and I just said in the app, like, what should I eat for lunch today? And it gave me a restaurant about 1/10 of a mile away. It gave me a specific dish because it knew I'd done a 30-minute swim and a 30-minute run that day. It knew my genetics. It recommended a specific dish based on my genetics, how I slept that night, how it worked out. That's, I think, what I'm most excited about with Wild Health is arming people with that AI app. If someone wanted to learn more about it, we have a website, Join Hollis, HOLIS, so joinhollis.com. Someone could learn more about that app, but that's going to be coming out very soon. And I think that'll be a really fun way to democratize precision medicine. Like, it's expensive to have doctors and health coaches and do all of this, but if we can take something and kind of put that in people's hands at a lower cost, I'm very excited about that.
Yeah, I can imagine. I'm excited just hearing about it.
Yeah.
Anything else, any last messages you want to leave our listeners?
No, this has been great and a lot of fun, and hopefully people learn something.
Yeah, I learned a lot, and I'm sure our listeners did as well. Thank you so much for joining us today, Matt.
Thank you.
This podcast is for informational purposes only. The podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. You should not use the information on the podcast for diagnosing or treating a health problem or disease, or prescribing any medication or other treatment. Always seek the advice of your physician or other qualified health provider before taking any medication or nutritional, herbal, or homeopathic supplement, and with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this or any other podcast. Reliance on the podcast is solely at your own risk. Information provided on the podcast does not create a doctor-patient relationship between you and any of the health professionals affiliated with our podcast. Information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to therein. If you think you have a medical problem, consult a licensed physician.